article that came out in Forbes magazine, August 1st, 2018. I want to thank one of my subscribers. I'll just call them JG for this article. Opioid use hasn't declined in the last decade despite addiction crisis. Didn't I tell you that this drug addiction is still going strong? Well, this Forbes magazine article is just driving that point home. Addiction to prescription opioids like oxycodone has risen so rapidly in the last decade that now an average of 40 people die of overdoses in the U.S. each day, according to the Centers for Disease Control and Prevention. Trump declared opioid addiction a public health emergency last year, bringing more attention to the crisis. But newly published research led by the Mayo Clinic is raising serious questions about whether awareness of the dangers of opioid prescriptions is translating to fewer prescriptions and a reduction in use of the powerful painkillers. Opioid prescription rates have remained flat for insured patients for over the last 10 years, according to data published today by BMJ. And even though prescriptions doled out to Medicare patients have recently shown signs of leveling, prescription rates for some of those older people are actually higher than they were a decade ago. The Mayo Clinic researchers launched their study knowing that groups like the CDC had been reporting recent declines in total amounts of opioid prescribed. But they were skeptical about those numbers. We wanted to know how the declines were experienced by individual people, said lead author Molly Jeffrey, PhD, scientific director of the Mayo Clinic Division of Emergency Medicine Research, in a statement. Did fewer people have opioid prescriptions? Did people taking opioids take less over time? When we look at it that way, we found a different picture. Researchers use anonymous insurance claim data from Optum Lab, determining opioid use by converting prescriptions of all drugs in the class into a uniform measure dubbed milligram morphine equivalents, MME. When they did that, they discovered that the highest rates of use, as well as the biggest proportion of long-term users, occurred among disabled people covered by Medicare Advantage plans. Patients in that group were taking an average daily opioid dose that equate to 9 5-milligram oxycodone pills in 2012. In 2016, that dose declined only slightly to 8 pills. And more than 51% of disabled Medicare beneficiaries per year were using opioids, compared to 14% of people on commercial insurance plans and 26% of non-disabled Medicare patients. In their study, the Mayo Clinic researchers expressed a number of concerns about their findings. The U.S. consumes a whopping 88% more opioids per capita than Germany, which is the second highest user of the drugs, they reported. During the entire 10 years, they studied an average daily dose for disabled Medicare patients stayed above 50 MME. raising the risk of overdose by at least twofold, overdoses of 20 mmes or less. The author pointed out that in February of this year, the Center for Medicare and Medicaid Services released a draft proposal suggesting that Medicare prescription drugs plans implement certain controls, such as supply limits for opioid prescription refills. You would think they would already have that in place. As for Trump's declaration of opioids, calling it a public health emergency, it is not clear whether or not that had any impact on efforts to curb addiction rates. I can tell you it didn't. Nothing is really changing in the news, so there's no indicator that what Trump did is making any difference at all. Trump renewed the declaration more than once. It's only good for 90 days. That's right, it's got to be renewed every 90 days. Senator Elizabeth Warren sent a scathing letter to Trump days before the expiration, questioning whether his administration had actually done anything to address opioid addiction. The declaration of a state of emergency should have freed up the Department of Health and Human Services to issue grants, conduct studies, hire public health specialists, and take more steps to accelerate development of new treatments and prevention measures. But your administration has been unable and or unwilling to tap the necessary resources, she wrote. So what can doctors do to help change the course of opioid use in the US? They should think seriously about whether long-term opioid use by any patient is really improving his or her ability to function. And if it isn't, they should seriously look at other pain management options. The Mayo Clinic researchers suggested in their study, evidence-based approaches are needed to improve both the safety of opioid use and patient outcomes, including pain management and ability to function, they wrote. So nothing has changed. Nothing has changed. And don't pay attention to these numbers, 40 people a day overdose. We know it's well above that. You know, these people are always trying to lowball the numbers, but don't even pay attention to that. We know it's much higher than that. And again, my doctor said it's probably anywhere from 500 to 520 people dying every day on these drugs. And I believe him because, you know, they're acting too frantic out in public. Please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And if you can support my channel, please do. Peace, family.